Hey guys, we are here at Foothills Weight Loss Surgeons with Premier Surgical, and I'm standing here with bariatric surgeon Dr. Mark Colquitt, and we're talking about World Obesity Day and how you guys make such an impact with this community here in East Tennessee.
Yes.
Talk about some of the things that people experience living with obesity.
Well, number one, the type 2 diabetes is very common among our patients, followed by hypertension, vascular disease, pulmonary disease, asthma, and so forth, and depression. Actually, depression, the treatment of that causes obesity as well, so it's a two-edged sword.
Absolutely. And being a bariatric surgeon, I'm sure you see it all. And one of the most common things I think in the public that we think of, bariatric, it's a quick fix. But I know that's a definitely misnomer.
You know, I tell my patients 2/3 of weight loss is up to them. And they have to put a lot of dedication into it. They have psychological evaluations, and they have to meet certain goals, so it's definitely not a quick fix.
And when they do go through the bariatric program, what are some of the results that you see after surgery?
Some of it's pretty remarkable. I was just discussing the other day with my nurse, a couple who had gastric bypass actually, and lost a tremendous amount of weight. They changed their life around, went back to school. Now they're going to law school together. So we see really dramatic changes because of that.
That's huge. And I mean, changing lives every single day right here in East Tennessee. And a hot topic right now is obviously weight loss. And the weight loss, different medications people can take, different drugs. Would you elaborate on that a little bit?
Yeah, so there's semaglutide and other medications. Some are injections, some are pills that have been around for a long time, but the newer ones are the injections that you're talking about. And we have a weight management program as part of our practice here that my nurse practitioner runs, and she sees those patients as well. So whoever comes into the office for evaluation, whether it's surgery or not, are really enrolled into both the weight management non-surgical part and surgical part, because even though they have an operation, bypass or sleeve, they're going to be treated with medications as needed if they not reaching their goals.
Absolutely. It's so important to have a partner every step in the way and something that's huge like that.
Right.
But what do you think about is going to happen in the future of people living with obesity with the combination practice like this?
I think it's important for people to know that the answers for obesity are complicated. We will help them sort that out. Whether you want non-surgical treatment or surgical, we have that as well. And so it's you know, we can help them figure that out.
Absolutely.
Yeah.
And do you have any advice or anything else on the epidemic we're facing right now in the world of obesity?
You know, if you have problems with obesity and you're considering how to do that, we can help you sort that out. And even though you might see me, the surgeon, talking about it, but I'm going to be conscious about what you need as far as surgery or not surgery, because our goal is to find the right solution for you.
Absolutely. Well, thank you so much for joining us today.
Yeah, you're welcome.
Definitely people need to give you guys a call. You're changing lives here right in East Tennessee, and definitely holding hands while you're doing it as well. And that's huge to have a partner. So definitely give Foothills Weight Loss Surgeons a call at 865-984-3413 or just visit the foothillsweightloss.com website.